An estimated 22 million Americans have been diagnosed with type 2 diabetes, which the CDC lists as the seventh leading cause of death in the United States. In type 2 diabetes, muscle cells become resistant to insulin hormone, thus limiting how much sugar can get into the muscle cell from the blood. As a result, blood sugar increases, as does the risk for cardiovascular disease and cancer. Regular exercise could be a therapy for sensitivity to insulin in those with type 2 diabetes. Current exercise guidelines recommend that adults with type 2 diabetes should get moderate to vigorous intensity aerobic activity 3 to 5 times per week combined with regular resistance exercise. So this review performed a search of all the research, initially yielding 27,041 studies, but only 16 randomized control trials passed their rigorous eligibility criteria. In summary, regular exercise was more effective in improving insulin sensitivity when compared to a control group. The diamond represents the overall effect of the studies, which you see favors exercise over the control. Also, this effect of exercise on insulin sensitivity got stronger when measured less than 48 hours after the last bout of exercise, from 48 hours to 72 hours after, and also greater than 72 hours. The authors conclude that compared to a control intervention, regular exercise improves insulin sensitivity in type 2 diabetes, and this effect can persist for more than 72 hours after the last bout of exercise. However, since the positive effect might wear off after 48 to 72 hours after the last bout of exercise, individuals with type 2 diabetes should consider exercising no less than every 48 hours to manage blood sugar and insulin resistance. Ideally, we exercise more, since chronic regular exercise has persisting effects compared to the diminishing effects of acute exercise bouts. Yet more research is needed to determine the effect of exercise after prolonged physical inactivity beyond 72 hours on insulin sensitivity. Knowing that the effects of exercise can last 24 to 72 hours between exercise sessions, clinicians can better handle unexpected breaks from exercise training, such as injury, personal or family reasons. Also, since the positive effects of exercise on insulin sensitivity is not lost during this 72-hour time frame, there might be no increased risk of hyperglycemia or need to adjust medication within this period. Although more research is needed, exercise should be one of the first management strategies for glycemic control in individuals with type 2 diabetes.